Hello everyone, my name is Jamie McManus. I'm a nurse practitioner student at Auburn University and I'm going to talk to you about neuropathy. Neuropathy is a generalized disease that affects the peripheral or the autonomic nervous system and it leads to abnormalities. If neuropathy affects the peripheral nervous system, it leads to problems such as atrophy, weakness, and cramps. If it affects the sensory nervous system, it causes loss of senses such as touch, loss of balance, and numbness and tingling. The autonomic nervous system is made up of the sympathetic and the parasympathetic nervous system. Therefore, it causes problems with the gastrointestinal system and the cardiovascular system. The most common symptoms of neuropathy are numbness, tingling, burning pain in one or both extremities, and normally the pain follows the stocking glove pattern. Patients also complain of feeling tightly wrapped. Risk factors for neuropathy include diabetes, hypothyroidism, vitamin B12 deficiency, alcoholism, chemotherapy, cancer, radiation, nerve injury, autoimmune disease, HIV, shingles, Lyme's disease. It's idiopathic and it's also hereditary. Some key questions to ask when working up a patient with neuropathy. First and foremost, are you diabetic? Over 50% of people with diabetes have neuropathy. So if a patient is diabetic, this is likely the cause of their pain. Secondly, does anyone in your family have similar symptoms? The most common cause of neuropathy is heredity. Therefore, if other family members suffer from neuropathy, it's likely that this is what's going on with this patient. Next, when did your symptoms start? If the symptoms had an acute onset, it's likely that the cause is Lyme's disease, Guillain-Barré syndrome, or toxin. If the symptoms were gradual, it's likely that the cause of the neuropathy is idiopathic or hereditary. When diagnosing a patient with neuropathy, the diagnosis is primarily based on history and physical exam. Therefore, it's very, very important to get a good history from these patients and also a good physical exam, which would include a neurological exam, checking the tendon reflexes, muscle strength and tone, ability to feel sensation, and coordination. Patients with neuropathy would have hypoesthesia, which is a reduced sensation to touch or cold. They could have hypo or hyperalgesia, which is painful stimuli, so they could have an increased or a reduced sensation to pain. They would also have allodynia, which is a pain to non-noxious stimuli, so they may have pain from their clothes or their bed linens. Also need to get a fasting glucose and a hemoglobin A1C on these patients to see if they are diabetic. If they are diabetic, is it controlled? You would expect the hemoglobin A1C to be greater than 6.5 if they are diabetic and the fasting glucose to be greater than 126. These patients also need a serum B12 level. Deficiency of vitamin B12 or pernicious anemia is a common cause of neuropathy, and often the nerve damage done is irreversible. So this really needs to be found out if that's what's going on. And low serum vitamin B12 is less than 200 picograms per milliliter. Treatment of neuropathy, first and foremost, correct the underlying cause. If they're diabetic, treat the diabetes. Correct the vitamin deficiency. Decrease alcohol. Treat the thyroid disorder. Secondly, they can have gabapentin, which is an anticonvulsant. It decreases neuropathic pain. Patients can have 1,200 to 3,600 milligrams per day over 3 divided doses. They can also have duloxetine, which is a selective serotonin norepinephrine reuptake inhibitor. This also reduces neuropathic pain, and the patients can have 60 to 120 milligrams per day. Education for patients with neuropathy. Foot care, especially if they're diabetic, they need to check those feet daily for calluses, blisters, cuts. They need to wear loose-fitting cotton socks. They need to wear padded shoes. They need to exercise every day, at least 30 minutes, at least 3 times a week, if not every day. This increases circulation and decreases neuropathic pain. They need to quit smoking and they need to quit drinking. Thank you.